Hey guys, welcome back to my channel. If you're new here, my name is Dr. Mashmi and currently I'm in my first year of residency in ENT. Now today in my video, I'm going to be talking about the muscles of pharynx. Let's head over to a topic now.
So let's start our topic now, which is the muscles of pharynx. Now the muscles of pharynx is basically the third layer in the structure of the pharyngeal wall. Now that is something I've covered in my first video in the series of anatomy of pharynx, where you can find out that there are 4 layers to the pharyngeal wall, and the third layer is the muscles of the pharynx. Now the muscles can be divided into 2 layers over here. One is the circular constrictor muscles and the second layer is the 3 longitudinal muscles. Now first we'll talk about the constrictor muscles. Now these constrictor muscles, they have a specific function. They enable the reflex act of swallowing to ensure prompt propulsion of the food bolus by a coordinated peristaltic wave into the esophagus. So basically they're assisting in the reflex act of deglutition. Now these constrictor muscles, they are circular and they are 3 in number: the superior constrictor, the middle constrictor and the inferior constrictor. And this inferior constrictor in turn can be divided into 2 parts, which is Stylopharyngeus and Crickopharyngeus. Next, the 3 longitudinal muscles, their function is basically to act as elevators and dilators of the pharynx. And this also has 3 muscles, which are the Stylopharyngeus, the Salpingopharyngeus and the Palatopharyngeus. Now, if you remember in my first video when I was talking about the pharyngeal wall structure, I told you about this layer, the pharyngobasilar fascia. Now, why was this layer very important? It was because I told you that the muscular layer, it does not extend to the superior most limit of the pharynx, which is basically the base of the skull over here. The muscle is deficient in the superior most part, and hence to give structural integrity to the pharyngeal wall, the pharyngobasilar fascia continues above and is thickened in this part, the superior most part, so as to maintain the integrity. So basically from here what we know is the muscular wall is not a continuous structure. It is deficient in some parts of it, mostly in the superior most part of the pharyngeal wall. Now let's head over to the constrictor muscles. So the first muscle we'll be talking about is the superior constrictor. The superior constrictor is the thinnest of all of the 3 constrictor muscles. It is shaped like a quadrilateral sheet. It slinks from one side of the pharynx to the other to form the superior most part of the pharynx. So this is basically the superior most muscle that lies in the pharyngeal wall. Now, in terms of all the muscles, we'll be talking about their origin, their insertion, their nerve supply and the action of that particular muscle. So coming to origin of this muscle, it originates from a number of places. So first, it originates from the pterygoid hamulus. Now, what is this pterygoid hamulus? It is a hook-like projection which arises from the lowest most portion of the medial pterygoid plate. As you can see in the structure over here, this is medial pterygoid plate, and in the lower part you can see a hook-like projection. This is the pterygoid hamulus. So this is the first origin of the superior constrictor. Next, it comes occasionally from the posterior surface of the medial pterygoid plate. As you can see, this is the posterior most part of the medial pterygoid plate. So this also gives origin to the superior constrictor. Next is the pterygomandibular raphe, which is basically a fibrous condensation which is running from the pterygoid hamulus over here. The pterygoid hamulus over here till to the retromolar trigon over here. So you can see this fibrous structure that you can see over here is the pterygomandibular raphe. The next origin is the posterior end of the mylohyoid line of the mandible, and lastly a few fibers also come from the side of the tongue. Next we go on to its insertion. Now this muscle, it runs upwards and backwards From their anterior attachment, as I already described you, which is the pterygoid hamulus, the posterior end of the medial pterygoid plate, the pterygomandibular raphe, and the posterior part of the mylohyoid line. From there, it runs upwards and backwards, and they fuse in the midline on the posterior aspect of the pharynx at the median pharyngeal raphe. As you can see here, these are both the sides of superior constrictor. They go upwards and backwards in this direction, and they fuse in the midline over here at the median pharyngeal raphe. Now some fibers, they also project upwards and attach to the base of the skull via the pharyngobasilar fascia. And posteriorly, the lowermost fibers, they sit comfortably with the overlapping middle constrictor muscle, which is the next muscle lying down, and it reaches the level of the laryngeal vocal folds. So this is the lowermost limit of attachment of the superior constrictor muscle. And on the lateral aspect, you will see that superior and the middle constrictor, they do not overlap completely, and therefore they leave behind a gap. Now this gap passes a lot of structures, which is very important to know. Now these structures are the stylopharyngeus muscle, the styloglossus muscle, glossopharyngeal nerve, and the lingual nerve. Now the first structure, which is the stylopharyngeus muscle, it passes downwards to insert into the pharyngeal wall, whereas the rest of the three structure, they pass forwards in the direction of the tongue. So this is the insertion of the muscle. Next, it is supplied by the pharyngeal and the superior laryngeal branches of the vagus nerve through the pharyngeal plexus. And its function is basically to constrict the uppermost part of the pharynx. Next, we head over to the middle constrictor. The middle constrictor originates from the inferior end of the stylohyoid ligament. As you can see here, this is the styloid process over here. This is the stylohyoid ligament. So it originates basically from the inferior most end of the stylohyoid ligament and also the greater and the lesser horns of the hyoid bone. Now when it comes to insertion, most of the fibers, as for superior constrictor, they run posteriorly and yet again they join at the median pharyngeal raphe, as you can see over here. This is the median pharyngeal raphe. The upper fibers, they encircle the lower posterior fibers of the superior constrictor. So basically what happens, the three constrictor muscles, they lie like a sheet covering the sides and the posterior most part of the pharynx, but they are also overlapping each other. Like the middle constrictor overlaps the lower part of the superior constrictor, the inferior constrictor overlaps the lower part of the middle constrictor. Next, the lowest fibers, they angulate downwards in a dorsoventral direction, and similar to superior constrictor, they also terminate at the level of the laryngeal vocal folds. The muscular anterior wall is incomplete between the middle and inferior constrictor. Thus, this place over here, it is getting covered by the thyrohyoid membrane. As you can see here in the structure, this is the thyrohyoid membrane. This is forming the anterior wall in the hypopharynx. Now, an important thing to know over here is that the internal laryngeal nerve and the superior laryngeal artery and vein, they pass medially on the superolateral aspect of this membrane. This is a very important structural anatomy to know. Next, the nerve supplies. It has the same nerve supply as the superior constrictor, which is the pharyngeal and the superior laryngeal branches of the vagus nerve via the pharyngeal plexus, and it also helps in constricting the pharynx, the middlemost part of the pharynx. As you can see here in these structures, how the middle constrictor muscle originates and goes for its insertion. Next, we'll head over to the third constrictor muscle, the most important one, which is the inferior constrictor. It is the thickest of all the constrictors, and it has two parts, the thyropharyngeus and the cricopharyngeus parts. Now, the thyropharyngeus is basically the oblique fibers of the inferior constrictor, and the cricopharyngeus part are the horizontal fibers of the inferior constrictor. So first we'll talk about the thyropharyngeus. It originates from the oblique line of the thyroid lamina, a small strip of lamina behind it, a small part of inferior thyroid horn, and part of tendinous fascia overlying the cricothyroid muscle. So basically, most of it is getting originated from the thyroid cartilage. Now, after getting its origin, these fibers are also passing upwards posteromedially to join the median pharyngeal raphe. As you can see in the structure over here, this is the median pharyngeal raphe, where the fibers are going posteriorly and medially like this, upwards and joining over here. Some fibers cross the raphe to fuse with the contralateral muscle. And the uppermost fibers, as I was already telling you before, they overlap with the middle constrictor muscle. Next, the cricopharyngeus. The cricopharyngeus takes its origin from the lateral aspect of the cricoid cartilage, emerging between the attachment for cricothyroid muscle and the inferior thyroid horn. This is a thicker and a more rounder muscle as compared to the thyropharyngeus muscle. Now, after its origin, these fibers pass horizontally. This is very important over here. As you saw, the thyropharyngeus muscle, the fibers were passing upwards, backwards, posteromedially. But in this case, in cricopharyngeus, the fibers are passing horizontally to encircle the cricoid arch, but without fusing in the midline at the pharyngeal raphe. So you'll see here the inferior constrictor, it has two parts. This is the thyropharyngeus part, the oblique fibers, and this is the cricopharyngeus part, which is basically the horizontal fibers. So the cricopharyngeus is a very important structure because it is helping in forming the sphincter of pharynx, which is continuous with the circular muscular coat of the upper esophagus below. Now this, what do you mean by a sphincter? A sphincter is an encircled portion in the wall of the pharynx, which is basically helping in regulating the passage of structures from the pharynx into the esophagus, and by closing down, it helps in preventing the regurgitation of food, etc., from the esophagus and up into the pharynx. So therefore, it's a very important structure to have. This sphincter is usually closed by default. It only opens momentarily during swallowing to pass the food bolus into the esophagus. The inferior laryngeal artery and vein and the recurrent laryngeal nerve, they pass upwards deep to the lower margin of the inferior constrictor. Now, as before, I have already told you about the action and the nerve supply of superior and middle constrictor. Inferior constrictor has the same supply. Next is a very important clinical importance about this inferior constrictor muscle is the Killian's dehiscence. Now, Killian's dehiscence is a potentially weak area in the structure of the pharyngeal wall. It is a triangular area in the wall of the pharynx between the oblique fibers of the thyropharyngeus and the transverse fibers of the cricopharyngeus, which are the two parts of the inferior constrictor. You will see the mucosa between these two muscles, they have very little support from the muscular structure, as a result of which is that it creates a potentially weak area from where a pharyngeal pouch can form. You'll see in the picture over here, its location is on the posterior aspect in the midline in the fusion point of these two muscles. As you can see here, this is the thyropharyngeus, this is the cricopharyngeus. This triangular area over here is the potentially weak area, which is known as the Killian's dehiscence. Now, other than Killian's dehiscence, there are some other dehiscence as well. There is something called the Lamier's dehiscence. Now, what is this Lamier's dehiscence? It is basically a similar triangular area which is lying between the circular fibers of the cricopharyngeus and the longitudinal fibers of the esophagus. As you can see over here, this triangular area over here is the Lamier's dehiscence. Now, what is the clinical significance of this? This area with the potentially weak area, it is also known as the gateway of tears because perforation can easily occur at this site during esophagoscopy. Secondly, it is a weak spot for the formation of something called as the pharyngeal pouch. Now, pharyngeal pouch is basically the prolapse of mucosa and the submucosal layer of the pharynx just above the cricopharyngeus at the level of C6. It is a convenient reservoir for trapping some or all of the food passing bolus. So you'll see what happens here, some of the food bolus will keep on accumulating in this particular area, and as a result of which over time it will lead to halitosis and regurgitation. A malfunction of esophageal sphincter may be a particular theory as to why this is happening. Initially this prolapse will extend posteriorly, but further posterior extension will be prevented by the prevertebral fascia. So, therefore, when there is a large prolapse, after going posterior for a while, it will go more laterally and inferiorly, mainly on the left side of the pharynx. And if it's progressing even further, if it's a very large prolapse, it will push the esophagus to one side and therefore leading to dysphagia and cachexia, and the pouch contents will be more liable to spill into the larynx, leading to respiratory infections. So we have learned about the Killian's dehiscence and what can happen due to the Killian's dehiscence, which is the pharyngeal pouch. So if we had to go through quickly through the constrictor of the pharynx, you'll see that their innervation and function is all the same. The posterior attachment is also the same. They mostly go into the pharyngeal raphe. Their anterior attachment for the superior constrictor important is the pterygomandibular raphe, the pterygoid hamulus. For the middle constrictor is the crater horn of the hyoid bone, and for the inferior constrictor is the cricoid cartilage and the. And as I was already telling you, there are some openings in the pharyngeal wall musculature. So you'll see that above the superior constrictor, as I was telling you, the muscle is dehiscent. So the pharyngobasilar fascia thickens up over there to maintain the integrity. Now this part transmits the cartilaginous part of the pharyngotympanic tube, the tensor and levator veli palatini muscles, palatine branch of the ascending pharyngeal artery. These all structures are passing through the pharyngobasilar fascia. Now between the gap between the superior and the middle constrictor passes the four structures I already told you. Then through the thyrohyoid membrane, the internal laryngeal nerve and the superior laryngeal vessels are passing. And lastly, below the cricopharyngeus, the recurrent laryngeal nerve and the inferior thyroid artery passes superiorly into the larynx. So these are all the four openings which we find in the pharyngeal wall musculature and the different structures that it is passing. Next, we head over to the three longitudinal muscles. The first one is the Stylopharyngeus muscle. It is a long conical muscle, and as you can guess, it gets its name from its origin, which means stylo, which means the styloid process. This muscle descends inferiorly between the internal carotid artery and the external carotid artery. This muscle is cylindrical above, but as it passes below, it becomes more flat and it enters the pharynx between the superior and the middle constrictor. So when we talk about its origin, we'll see it originates from the medial side of the base of the styloid process within the temporal bone. This is the styloid process over here, and this is where it gets its origin from, as you can see from its name. Now, it passes downwards and it is inserted into the posterior superior border of the thyroid cartilage alongside the palatopharyngeus muscle. And also some fibers merge with the lateral glossoepiglottic fold. This muscle is getting its nerve supply from the glossopharyngeal nerve. Now this nerve, while it is going towards the tongue, it curves medial to lateral on the posterior-inferior border of the stylopharyngeus and innervates it. Its action is to elevate the pharynx, and it also helps in some peristaltic movement of food bolus, and it also helps in elevating the larynx. So as you can see in this is the stylopharyngeus muscle. This muscle getting its origin in the styloid process, passing down to get inserted into the thyroid cartilage alongside the palatopharyngeus muscle. Next, we head on to palatopharyngeus. Now, this palatopharyngeus muscle, it is not only a muscle of the pharynx, but it also constitutes some part of the soft palate. This muscle takes its origin by two heads, the anterior head and the posterior head. Now these two heads, they get separated from each other by the levator veli palatini muscle. Now the anterior head, it gets its origin from the posterior border of the hard palate. As you can see over here, this is the posterior border of the hard palate and the anterior and superior surfaces of the palatine aponeurosis. And the posterior head, that gains its attachment from the superior surface of the palatine aponeurosis. Now after this, what happens is both the heads diffuse with each other at the lateral border of the palatine aponeurosis. Then, as I was telling you before, it is joined by the fibers of the stylopharyngeus muscle. After that, it passes and arches downwards to insert into the posterior border of the thyroid lamina alongside the stylo and the salpingopharyngeus muscle. Therefore, what it is forming is, it is helping in forming the posterior fascial pillar. I have told you before while I was talking about the oropharynx anatomy, the tonsils, they lie in between the anterior and the posterior pillar. Now, the posterior pillar is basically formed by this palatopharyngeus muscle. As you can see in the picture over here, here it gets its origin, it passes downwards and inserts itself into the thyroid lamina. You can see here how it forms an arch around the pharynx. Now when it comes to nerve supply, this has a different nerve supply than stylopharyngeus. It is supplied by the pharyngeal plexus. But when it comes to action, it is very similar. It also helps in elevating the pharynx and the larynx. As I was telling you, it helps in formation of the posterior pillar. It constricts the palatopharyngeal arch to assist in swallowing. It enables the concave shape of the oral surface of the palate because of its arch. And lastly, this is something I've told in my earlier videos, is that it helps in forming the passovins ridge and therefore helping in closure of the nasopharyngeal isthmus during swallowing, therefore preventing regurgitation. Now we'll come on to the last muscle of the pharynx, which is the salpingopharyngeus muscle. This muscle, it has a long and slender shape with a wider distal end, the structure of which is reminiscent of a Greek trumpet bearing its name. This Greek trumpet is known as salpinx. That is where it's getting its name from, because of the shape of its structure. It originates from the lowermost part of the cartilaginous pharyngotympanic tube. This is something that I've shown you while I was showing you the endoscopic anatomy of the nasopharynx. Next, it descends internally in the salpingopharyngeal fold and it gets inserted by blending with the palatopharyngeus muscle. It is supplied again by the pharyngeal plexus and it also helps in elevating pharynx. It also helps the soft palate muscle, the tensor veli palatini, in opening the cartilaginous part of the eustachian tube during swallowing. As you can see here, these two are the salpingopharyngeus muscle. It is shaped in the form of Greek trumpet known as the salpinx. So if we had to summarize the three longitudinal muscle, palatopharyngeus and salpingopharyngeus, they are supplied by the vagus nerve, but the stylopharyngeus muscle is supplied by the glossopharyngeal nerve. And other than elevating the pharynx, the palatopharyngeus muscle has an additional function of closing the oropharyngeal isthmus and also the nasopharyngeal isthmus. I hope that you have liked my video and you have found my video useful and take something away from it. If it has helped you, kindly press on the like button below. If you have any questions, you can put them down in the comment section and I will get to you. If my video is helping you, kindly subscribe to my channel. The more subscribers I keep getting, the better and more content I can continue making. So please subscribe to my channel and share my video with your friends and leave your comment behind if there's any topic that you want covered in the next couple of videos. Thank you.